I'm Dr. Nada Albatish. I'm a restorative dentist. I practice just north of Toronto. I have two practices, Smile Story Dental and All Smiles Dental, and I've been practicing dentistry for the last 18 years. I completed my dental school at the University of Toronto. I did a general practice residency for a year after that before I started working in private practice. Today, my clinical practice is really focused on comprehensive care, and my skills really are around restorative dentistry, interdisciplinary treatment planning, and a lot of patient care that involves the disciplines of restorative dentistry, ortho, and perio. When I was 13 years old, I was visiting my grandparents one summer. I really had never thought about dentistry before. I was very young and I was bored. When I was 13, we didn't have social media and cell phones. And I would take these blank sheets of drawing paper with coloring pencils and I would copy these pictures of animals from magazines onto the paper in color and make them look as close as I could to the real thing. And one day my grandfather came up, saw this drawing that I had left on the desk, and he said, "Who drew this?" And I said, "Oh, that was me. Just a kid living my life bored in the summer." He said, "My goodness, you are such an artist. You should really think about being a dentist." Before that, I'd never thought about dentistry, and I really did brush that off, but it somewhere stayed playing in the back of my mind. And so as I got older, discovered that I have a real interest in science. It's sort of the combination of science, art, psychology that kind of drew me back to the idea of dentistry. My favorite thing about practicing dentistry is the people. I get to work with incredible people on my team. I get to do transformative things for my patients. The more I learn about leadership and psychology, the more I can uplift my team. The more involved I've gotten in restorative dentistry, clinical dentistry, interdisciplinary care, the more I've gotten to know and been able to produce amazing outcomes for our patients with my peers, with the specialists that I work with. And so really when I think about all of it, I love the science, I love the art, I love the technology, I love human psychology, human behavior, I love the business aspect, I love growing in all of those parts, I love learning. But when I really think about it, what kind of really drives me and motivates me every day and inspires me to do better is seeing the difference that we're making for people. And really, it's the people that drives it for me. That is my favorite part of dentistry. The top three challenges that dentists face today. Number one, overload of information. We have information coming at us from everywhere. Social media, magazines, YouTube, all kinds of different sources of information, different people marketing different things. And how do we know what the truth is? How do you know that when you are about to take a step in practice, you need the strongest kind of cement, you need a transition plan, you want to sell your practice, you need some kind of accounting strategy. Who are your trusted people? Challenge number two for dentists that I've seen specifically in the last 5 years has been building a place that people actually want to work. When we do that in study clubs, we care about people, we help people. Every opportunity we get, we build a strong culture. You take care of your team. They're in a better position in their own health, in their own mindset, in their own lives. It starts to solve the issue of giving people a place where they really want to work and where they really want to be, and that actually improves their lives. And the third challenge that I've seen that dentists face today is the challenge of communication. And I think this is a human challenge that no matter what decade you look at, you can say, yeah, communication is a challenge. The difference these days generally is that people's levels of anxiety are higher, people's levels of depression are higher, economic pressures are higher, financial strain on families is more. So the way that we communicate when people are dealing with these challenges really has changed. And perhaps it's become one of the most challenging decades. So that is something that dentists really do need to be aware of. And you have to really identify what the challenges are for the people in front of you so you can speak to them in a way that reassures them. Speak to them in a way that they need to hear. Speak to them in a way that makes sense to them. Speak to them in a way that makes whatever steps they take a win for them. As a clinician, continuing education is probably the most important thing that you can do. And the way I think about this is this. I remember the day I graduated from dental school. I took this picture holding my degree over my head. We had worked hard to get there, like a hooray. So for me, education really is the foundation of all that. When we started dental school, I remember in first year, the beginning, it might have even been Frosh Week. And when they started talking to us, they talked about lifelong learning. And it sounded cool because I was always very studious, but I didn't really understand it. Now I understand it. One of the key trends that I've started to see recently, and I think is really going to take off in the dental education space, is a trend towards more in person, small group learning. And it's interesting because if you think back in the last 5 years, when the pandemic happened, it seems like ancient history already, but it really shifted us into technology. It really shifted us into online learning. It really shifted us into more independent styles of learning. I started to see year over year the collaboration changing within the group in the study club. And so now we've got about 50 members in the study club, and it's absolutely incredible. When someone runs into a challenge, they ask the group. Guess where they get the best help they've ever gotten? From this group. And that's why I say the best way to turn competition into collaboration is through education, because I've watched it happen.